Has your child experienced cavities, or have you had a child in pain because of cavities to a level that they can't even eat, or having swelling in their mouth because of cavities? Today, I'm going to discuss cavities in baby teeth, what causes this and what we can do to prevent this issue. The commonest cause of cavities in children is dietary habits. A diet that is packed with sugar or carbohydrates that are not cleaned after is an issue. Due to when the child is taking things like ice cream or even like too much sugar in their tea or in their porridge, or sweets and snacks, or even things like chips, I mentioned carbohydrates, what this makes it the mouth a good breeding ground for bacteria that can cause cavities. So we want to avoid to give children a highly sugary diet, or even when we're giving them tea and porridge and such things, we don't necessarily need to put sugar in their diet. So this can easily cause cavities, and they can be avoided by adjusting a child's diet. Out of ignorance, sometimes the mother or the nanny or a child's caregiver introduces their saliva into the child's mouth, maybe through spoons, or you want to taste whatever the child is eating, or even chewing for them. This sometimes can introduce cavity-causing bacteria into the child's mouth. Now, we want to avoid to do this. You don't want to share saliva with the child. Even other children can introduce bacteria, this kind of bacteria, into the child's mouth unknowingly. So this is a habit that people are ignorant about, but it can actively cause bacteria in the child's mouth. Poor oral hygiene practices in children can cause cavities. Now, people are oblivious of the fact that these children need to have proper oral hygiene practices as well, because they are eating a lot of food, you're feeding them throughout, and even when they are younger, there's milk being in the mouth and all these things. So if anything that has sugar is in contact with the child's tooth for a long time, this causes the child to be prone to cavities. So you want to have proper oral hygiene practices from the beginning. Even when the first tooth comes out, you can clean this tooth using a damp piece of cloth, and you don't have to brush that tooth manually. But then with time, you can introduce a toothbrush. Doesn't have to, and then you can look for baby toothpaste that don't have fluoride up to around 2 years of age. We can introduce fluoridated toothpaste from the age of 3 years, and then you want to supervise a child brushing their teeth up to around the age of 7 to 8 years. This is the time you can be confident that they are doing the oral hygiene practices in the proper way.